As we grow older, personal hygiene can become more challenging. Mobility issues, cognitive decline, reduced sensory awareness, and emotional factors all contribute to difficulties in maintaining hygiene. What might seem like minor oversights can actually result in major health concerns such as infections, skin issues, and even life-threatening conditions. Doctors and caregivers are often the first to notice these hygiene-related warning signs. These aren't just small lapses, they often indicate underlying physical, mental, or emotional health issues. In this detailed video, we will explore 7 personal hygiene mistakes elderly individuals frequently make. Understanding and addressing these can significantly improve quality of life, prevent hospitalizations, and promote dignity and independence. Mistake number 1: infrequent bathing or showering. As people grow older, daily routines that once seemed simple, like taking a shower or bath, can become daunting and sometimes even dangerous. Infrequent bathing is one of the most noticeable hygiene issues among the elderly, and it's something that doctors pick up on almost immediately during checkups or hospital visits. While many may assume this lapse in hygiene is due to laziness or neglect, the reality is far more complex and deeply rooted in physical, emotional, and cognitive challenges. For many seniors, physical limitations are a significant barrier. Conditions like arthritis, back pain, or reduced mobility can make it difficult to get in and out of the tub or stand for long periods under a shower. The fear of falling is real and often justified, as bathroom slips are among the leading causes of injury in older adults. After one bad experience, many seniors become overly cautious, choosing to bathe less frequently rather than risk another accident. Cognitive decline also plays a role. Elderly individuals with dementia or early-stage Alzheimer's may simply forget when they last bathed or fail to recognize the importance of personal cleanliness. They might not notice or care about body odor or greasy hair the way they once did. Depression is another factor. When someone is feeling hopeless or withdrawn, maintaining hygiene can seem unimportant or overwhelming. Add to this the fact that many seniors live alone without reminders or encouragement, and it becomes easy to understand why bathing gets neglected. Doctors are often the first to notice the consequences. Strong body odor, unwashed hair, flaky or irritated skin, and signs of infection are common indicators. In more serious cases, lack of hygiene can lead to fungal infections, particularly in skin folds or urinary tract infections in those who are incontinent. These conditions don't just affect comfort, they can have serious medical implications if left untreated. The solution starts with understanding and empathy. Creating a safe and comfortable bathroom environment can reduce fear and make bathing more accessible. This might mean installing grab bars, using non-slip mats, or adding a shower chair. For some, sponge baths on days they don't shower can help maintain cleanliness without causing stress. It also helps to establish a regular bathing schedule so it becomes part of the routine again. In some cases, a trusted caregiver's gentle assistance may be necessary, but it's crucial that this help be offered respectfully and with dignity. Keeping clean is not just about hygiene. It's about self-respect, confidence, and maintaining a sense of normalcy. When the elderly are supported in this simple but essential task, it can make a profound difference in their health and happiness. Mistake number 2: wearing the same clothes for too long. As people age, many aspects of daily life begin to change, including the way they manage their clothing. One of the more subtle, yet telling, signs doctors and caregivers notice in elderly individuals is the habit of wearing the same clothes for extended periods without washing or changing them. At first glance, it might not seem like a major issue. But when someone wears the same outfit for days or even weeks, it often signals a deeper struggle, and the effects on both hygiene and health are significant. Several reasons contribute to this pattern. For many seniors, the act of changing clothes isn't as easy as it once was. Arthritis can make it painful to remove tight garments or manipulate buttons and zippers. Reduced mobility, stiffness, or fatigue can make bending or lifting their arms a challenge. For someone who lives alone and doesn't receive help, just the thought of undressing and dressing again can be exhausting. As a result, they may opt to stay in the same outfit day after day to avoid the hassle. There's also an emotional side. Some elderly individuals form strong attachments to particular clothes, perhaps a shirt that brings comfort or a sweater tied to memories. Others might feel that they're not getting dirty since they're no longer working or going out, so changing clothes doesn't feel necessary. In cases of depression, motivation to do basic tasks like laundry or outfit changes can disappear entirely. Doctors notice the effects quickly. Clothes that are stained, wrinkled, or give off a musty odor often point to hygiene neglect. But the issue goes deeper. Wearing unwashed garments can lead to skin irritation, rashes, or even fungal infections, especially in warm or humid climates. Undergarments, in particular, need regular changing to prevent infections in sensitive areas. If an elderly person is incontinent or experiences light leakage, dirty clothing becomes not just uncomfortable, but a health risk. The solution lies in creating systems that make changing clothes easier and more pleasant. Having a simple wardrobe with easy-to-wear, comfortable items can help. Stretchable fabrics, Velcro closures, and loose-fitting clothes reduce the strain of dressing. For those with limited energy, laying out clothes in advance or enlisting the help of a caregiver for a quick change can make all the difference. It also helps to keep laundry routines manageable, perhaps smaller, more frequent loads or assistance from family or a home care service. Wearing fresh clothes is about more than hygiene. It impacts how someone feels about themselves. Clean, comfortable clothing can uplift mood, boost self-confidence, and even encourage social interaction. When the elderly are supported in maintaining this basic yet meaningful habit, they feel more cared for and more human. Mistake number 3: neglecting oral hygiene. Neglecting oral hygiene is one of the most overlooked yet impactful mistakes many elderly individuals make. What might begin as skipping a brushing session or forgetting to floss can slowly turn into chronic neglect, leading to serious dental problems and broader health concerns. For doctors and caregivers, the signs are immediate and unmistakable: dry mouth, bad breath, decaying teeth, gum inflammation, or even visible pain when chewing. There are several reasons why oral hygiene tends to decline with age. One major factor is the physical challenge. Arthritis or hand tremors can make gripping a toothbrush or maneuvering dental floss quite difficult. Electric toothbrushes can help, but only if they're available and used correctly. For seniors with cognitive issues like dementia or Alzheimer's, remembering to brush or understanding why it's necessary may no longer come naturally. They might even resist help due to confusion or embarrassment. Then there's the issue of dentures. Many older adults wear full or partial dentures, and while these solve some dental issues, they come with their own set of hygiene responsibilities. Dentures must be cleaned daily, removed at night, and soaked to prevent bacterial buildup. But many seniors either aren't taught how to care for them properly or simply neglect the process due to fatigue or forgetfulness. The result is often inflamed gums, sores, or fungal infections like oral thrush. Medications also play a role. Many commonly prescribed drugs for blood pressure, depression, or heart conditions cause dry mouth, a condition that reduces saliva and increases the risk of tooth decay and gum disease. Without adequate hydration and oral care, this problem worsens over time. The consequences are far-reaching. Poor oral hygiene doesn't just cause pain and bad breath. It's been linked to more serious health issues like heart disease, diabetes complications, and even respiratory infections. When infections in the mouth spread, they can affect other organs, especially in those with weakened immune systems. Malnutrition can also become a concern if chewing becomes painful and seniors begin avoiding healthy, crunchy foods like fruits and vegetables. But with the right approach, these risks can be greatly reduced. Routine dental checkups are critical, even for those with dentures. Caregivers can help by reminding or assisting with brushing and flossing. Using soft bristle or electric toothbrushes, antiseptic mouthwash, and proper denture cleaners makes daily care easier and more effective. For those with limited dexterity, floss picks or water flossers can be game changers. Encouraging good oral hygiene isn't just about teeth, it's about preserving dignity, comfort, and overall health. When seniors maintain a clean and healthy mouth, It boosts confidence, reduces disease risk, and helps them continue enjoying life's simple pleasures, like a smile or a good meal. Mistake number 4, improper nail care. At first glance, fingernails and toenails may seem like minor details in the grand picture of personal hygiene. But to trained eyes, especially those of doctors and caregivers, improper nail care in elderly individuals is one of the earliest and clearest signs of declining self-care. Overgrown, thickened, yellowed, or dirty nails don't just affect appearance. They can lead to serious health issues and affect mobility, comfort, and even social interaction. Why do so many elderly people struggle with nail care? The reasons are both physical and practical. As we age, nails naturally become harder, thicker, and more brittle, especially toenails. Conditions like arthritis, diabetes, and reduced vision make it difficult for seniors to trim their nails properly. Toenail care is particularly problematic. Reaching the feet becomes harder due to stiffness, balance issues, or weight gain, and many simply stop trying. In some cases, seniors may not even realize how bad their nails have become. Long or curled nails can become uncomfortable, catch on clothing or bedding, and even lead to scratches or wounds. For diabetics, improper foot and nail care can be especially dangerous. A small cut near the toenail can escalate into a serious infection or ulcer, which, if untreated, might lead to hospitalization or worse, amputation. Unclean nails can also become a breeding ground for bacteria and fungi. Nail fungus is common among older adults and often goes unnoticed until the nails become discolored, painful, or begin to emit an odor. Bacterial buildup under long nails, especially if hand washing is inconsistent, can easily spread infections, particularly dangerous for seniors with weakened immune systems. Beyond health concerns, unkempt nails can impact dignity and self-esteem. Seniors who are aware of their poor nail hygiene might feel embarrassed about their hands or feet, leading them to avoid social situations, meals with others, or even medical appointments. It becomes a quiet barrier to connection and comfort. Fortunately, with a little support and attention, nail care can be managed effectively. Regular visits to a podiatrist or professional caregiver for trimming and inspection are extremely helpful, especially for those with chronic conditions like diabetes. Family members and in-home aides can also assist with gentle, routine nail maintenance. Using proper nail tools, like nail clippers with grips, nail files, and foot soaks, makes the process easier and safer. For fungal infections, early treatment with antifungal creams or prescriptions can prevent long-term damage. Maintaining clean, trimmed nails might seem like a small thing, but for the elderly, it plays a big role in their overall sense of well-being. It contributes to hygiene, prevents health complications, and most importantly, supports their sense of dignity and self-worth. Sometimes the smallest acts of care, like clean nails, speak the loudest in preserving a person's humanity. Mistake number 5, not changing undergarments regularly. Among the many personal hygiene habits that can quietly slip as people age, not changing undergarments regularly is one that doctors and caregivers notice almost immediately. It's often a hidden issue, unseen by casual visitors, but clearly evident to healthcare professionals who work closely with elderly patients. This habit may seem minor, but it can lead to a host of physical, emotional, and even social complications. Undergarments are the first line of contact between the body and clothing. They absorb sweat, bodily fluids, and incontinence leaks, making regular changes essential for maintaining hygiene. However, many seniors begin to skip this basic task. Some may wear the same undergarments for several days, or worse, until they are visibly soiled. For doctors, this raises concerns not just about hygiene, but about deeper issues such as mobility challenges, cognitive decline, or emotional distress. Why does this happen? In many cases, it comes down to difficulty and discomfort. Bending over to remove and replace clothing can be physically painful due to arthritis, joint stiffness, or balance issues. If a senior lives alone or doesn't have regular support, they may delay changing until absolutely necessary. Those dealing with incontinence may feel embarrassed, leading them to try and hide accidents rather than addressing them. In some cases, it's tied to forgetfulness. Cognitive decline due to dementia or Alzheimer's can make it hard to remember whether undergarments were changed that day or even how often they should be changed at all. When routines are disrupted, personal hygiene tends to fall apart quickly. Unfortunately, the consequences of not changing undergarments regularly are serious. Prolonged exposure to moisture and bacteria can cause skin rashes, irritation, or painful infections, especially in sensitive areas. Urinary tract infections, UTIs, are common in older women, and improper hygiene can significantly increase the risk. In men, poor hygiene in the groin area can lead to fungal infections or discomfort. For both, it becomes a silent struggle that causes discomfort and can impact their overall health. Addressing this issue requires both compassion and planning. For seniors who forget or avoid changing undergarments, setting a routine can help. Caregivers or family members can lay out clean clothes and offer gentle reminders. Easy-to-remove undergarments, like those with stretchy waistbands or Velcro, can reduce the physical difficulty of changing. For those dealing with incontinence, having an adequate supply of adult diapers or absorbent underwear and knowing how to dispose of them discreetly is crucial. It's also important to maintain a judgment-free environment. Seniors often feel ashamed when confronted about personal hygiene. A compassionate approach, focused on health, comfort, and dignity, makes them more willing to accept help. In the end, regularly changing undergarments isn't just about cleanliness. It's about helping elderly individuals feel respected, comfortable, and cared for in one of the most private aspects of their daily lives. Mistake number 6, ignoring foot care. Foot care is one of the most neglected aspects of personal hygiene in the elderly, and yet it's one of the most important. Doctors and caregivers often identify foot issues early during physical exams, not only because feet are easy to overlook in daily hygiene routines, but because foot problems often indicate deeper health concerns. For many older adults, ignoring foot care is not a matter of choice, but a result of physical limitations, discomfort, or simply not realizing how vital it is. Feet carry us through life, and they endure the daily weight of our bodies. Over time, they show the signs of aging just like any other part of the body. The skin becomes dry and thin, circulation slows, and toenails grow thick and difficult to manage. For seniors, especially those with diabetes, even a small foot issue can spiral into a serious health crisis. A simple blister or cracked heel can turn into an ulcer or infection if not treated early. One of the major challenges is the ability or inability to reach the feet. Bending over to clean, inspect, or trim toenails can be difficult for elderly individuals who suffer from arthritis, hip or back problems, or balance issues. Some are afraid of falling while trying to wash or examine their feet, so they skip it altogether. Others may not have the proper tools to maintain their foot hygiene or may not understand the importance of regular care. Neglecting foot hygiene can lead to a range of issues. Dry, cracked skin can become painful or infected. Fungal infections like athlete's foot or toenail fungus thrive in unwashed, enclosed environments, especially when socks are not changed frequently. In severe cases, untreated wounds or infections can lead to hospitalization, and for diabetic seniors, even amputation. Doctors are trained to observe these signs immediately. Discolored toenails, foul odor, peeling skin, or swelling are all red flags. For patients with circulation problems or neuropathy, these issues can go unnoticed because the feet may feel numb. That's why regular foot care isn't just about cleanliness, it's about injury prevention and early detection. But proper foot care doesn't have to be complicated. Washing feet daily with warm water and gentle soap, drying thoroughly, especially between the toes, and applying moisturizer can prevent many problems. Seniors should avoid walking barefoot to reduce the risk of cuts or infections. Toenails should be trimmed regularly, but carefully. Cutting too short can cause ingrown nails or wounds. For those who struggle, seeing a podiatrist or asking a caregiver for help can make all the difference. Ultimately, foot care is more than a physical task, it's a form of self-respect. Clean, healthy feet help seniors move with confidence, reduce the risk of falls or infections, and support their independence. When feet are cared for, the entire body feels more balanced, and doctors notice it immediately. Mistake number 6, ignoring foot care. Foot care is one of the most neglected aspects of personal hygiene in the elderly, and yet, it's one of the most important. Doctors and caregivers often identify foot issues early during physical exams, not only because feet are easy to overlook in daily hygiene routines, but because foot problems often indicate deeper health concerns. For many older adults, ignoring foot care is not a matter of choice, but a result of physical limitations, discomfort, or simply not realizing how vital it is. Feet carry us through life, and they endure the daily weight of our bodies. Over time, they show the signs of aging just like any other part of the body. The skin becomes dry and thin, circulation slows, and toenails grow thick and difficult to manage. For seniors, especially those with diabetes, even a small foot issue can spiral into a serious health crisis. A simple blister or cracked heel can turn into an ulcer or infection if not treated early. One of the major challenges is the ability or inability to reach the feet. Bending over to clean, inspect, or trim toenails can be difficult for elderly individuals who suffer from arthritis, hip or back problems, or balance issues. Some are afraid of falling while trying to wash or examine their feet, so they skip it altogether. Others may not have the proper tools to maintain their foot hygiene, or may not understand the importance of regular care. Neglecting foot hygiene can lead to a range of issues. Dry, cracked skin can become painful or infected. Fungal infections like athlete's foot or toenail fungus thrive in unwashed, enclosed environments, especially when socks are not changed frequently. In severe cases, untreated wounds or infections can lead to hospitalization, and for diabetic seniors, even amputation. Doctors are trained to observe these signs immediately. Discolored toenails, foul odor, peeling skin, or swelling are all red flags. For patients with circulation problems or neuropathy, these issues can go unnoticed because the feet may feel numb. That's why regular foot care isn't just about cleanliness, it's about injury prevention and early detection. But proper foot care doesn't have to be complicated. Washing feet daily with warm water and gentle soap, drying thoroughly, especially between the toes, and applying moisturizer can prevent many problems. Seniors should avoid walking barefoot to reduce the risk of cuts or infections. Toenails should be trimmed regularly but carefully. Cutting too short can cause ingrown nails or wounds. For those who struggle, seeing a podiatrist or asking a caregiver for help can make all the difference. Ultimately, foot care is more than a physical task, it's a form of self-respect. Clean, healthy feet help seniors move with confidence, reduce the risk of falls or infections, and support their independence. When feet are cared for, the entire body feels more balanced, and doctors notice it immediately. Proper personal hygiene is essential for the health and well-being of the elderly, yet many seniors unknowingly make hygiene mistakes due to physical limitations, cognitive decline, or health issues. The 7 common mistakes discussed, such as infrequent bathing, neglecting foot care, and improper oral hygiene, can lead to serious health complications like infections, rashes, and even social isolation. However, these issues are preventable with the right support and care. Family members, caregivers, and healthcare providers can help seniors maintain proper hygiene by encouraging daily routines, offering assistance, and using appropriate products. It's important to approach these concerns with understanding and compassion, ensuring that seniors feel dignified and comfortable in their daily lives. By addressing these mistakes and providing the necessary support, we can help seniors live healthier, more independent lives, free from unnecessary discomfort and health risks. Hygiene is not just about cleanliness, it's key to maintaining overall well-being.